Main risk factors for preventable chronic diseases are tobacco use, lack of physical activity, and excessive alcohol use. The risk factors have caused unpreventable and preventable diseases like disability and death. To reduce these risk factors, prevent diseases or injury before it ever occurs, reduce the impact of a disease or injury that has already occurred, soften the impact of an ongoing illness or injury that has lasting effects. We all need to invest our time and money in improving healthy lifestyle behaviors by increasing physical activity and improving our diet. By doing this, almost 35% of early deaths will be avoided. Our integrative nutrition health specialist, Betty Olayinka Folari Akinlosotu, aka BOFA, advocates for this every Sunday on Health Corner and Nutrition segments showing on Healthy Living with BOFA channel, where she also features professionals on interview with expert segments. Join us every Sunday, 2 p.m. U.S. time, 7 p.m. UK and Nigeria time, 8 p.m. South African time. See you there.
Last week on the show, I educated on medical barriers that prevent a woman from becoming pregnant. Many calls came right after the show, people asking if there is any other reasons aside from the medical conditions that I mentioned last week. And I don't think they have problem with all that I said. If not, they won't be curious, because what really got my attention here was that they were so curious to know more reason that could be a barrier that could delay them from getting pregnant. I could see that in their voices. I could feel it. And my answer was yes. And these other reasons are natural conditions which are considered to be influence and implication of nutrition on fertility. So today we are talking about the influence and the implication of nutrition on fertility. So I want you to sit back and fasten your seatbelt while we get started right after the break. I'm Dr. Betty, broadcasting live from BOFA Health and Nutrition Talk Show. Let's take a break. I'll be right back.
Health is wealth. Vital is vital. You gotta take care of yourself.
Hello, do you want to live your best? You want to live your way into a healthy and beautiful body, free from all forms of diseases such as diabetes, high blood pressure, cancer, hemorrhoid, and so on? Are you limited to particular food intake due to your health status? Oh yeah, I bring to you good news, as you can eat what you want. Contact us today for a service, holistic nutrition consulting based on individual health status such as diabetes, high cholesterol, high blood pressure, among others. Visit us in our office at 10039 Bisonet Street, Suite 228D, Houston, Texas, with zip code 77036. You can as well book an appointment with us on our website www.begandbumservices.com or call 347-61 35485 347-61 35485. At B&B, your health matters to us.
Health is wealth. Vital is vital. You gotta take care of yourself.
Welcome back, viewers, and thank you so much for joining us today on the show. Our discussion is titled Influence and Implication of Nutrition on Fertility. And I want you to pay more attention today on all that I'm going to advise, educate on today, because they're very, very important information. If it's not useful to you, you want to share it with others. Yes. If you know that this information is nothing to you, please share with others, because you don't know who needs this information out there. And let me tell you, all this information you get for free. If you go to a specialist, like you want to see me one-on-one, you pay for consultation before you even get a word from me. So you're getting it for free. You just want to appreciate it. Yes. Please share this information with others right now and call them to the show to get some information they have been waiting for. So we're going to get right into today's discussion, which is titled Influence and Implication of Nutrition on Fertility. If women are healthy, and they are in their most fertile use, meaning that they are not in menopause. Let me put it that way. And the male partners are also healthy and they have no factors that could decrease their fertility. There is a 20% chance every month for such a woman to get pregnant with regular intercourse. However, there are also natural reasons, like I mentioned last week, medical reasons. There are natural reasons why a woman cannot get pregnant, and this will be treated today as implications preventing women from getting pregnant, as well as how nutrition, what we eat, influences fertility. But I would like to briefly educate more on natural reasons, or call it conditions, that also affect fertility. Things that happen to us that we are not even paying attention to. Things we don't consider as very, essential, that can cause the delay. These are the things, because ladies and gentlemen, we got ourselves into a lot of problems caused by ourselves, by environment, by people around us, by things we do, by things we get ourselves involved on a daily basis. Yet, we have no idea that this could be the cause of our problems. And that is what I label natural reasons, or you call it natural conditions. And I'll be treating it as implications that prevent women from getting pregnant, and which will lead us to how nutrition, because talking about these reasons, it's basically on what we eat on a daily basis and what we do. So let me talk about few of these natural reasons that also affect fertility. And let me tell you this, there are many factors that may contribute to infertility, and I'll mention few. And number one is timing sexual intercourse only on days of ovulation. Some couples do this. They want to make sure that when they are having sex, it is their ovulation time. No. What if you guys are not accurate in timing? Do you ever think about it? Especially when your period is irregular. How do you want to time your ovulation? How do you want to calculate it if you have irregular menstrual cycle? This is going to be hard for you. That is number one. Number two is lack of sexual intercourse. Yes, some couples don't have sex, and yet they want to have babies. They don't touch each other. Maybe even they want to do it maybe once a month or once in 2 weeks. Some live apart, yet they still want to have baby. They see once a while, in a month, in a year, yet they cry for babies. How do you want the baby to come? Please tell me, when you are not having sex. All this, we don't pay attention to it. Yes. Or you realize that you've been having sex with your wife, now she couldn't conceive. You want to leave her and go for another woman, and yet you are still complaining that the one you ignored is not getting pregnant without touching her. How do you want her to get pregnant when you are not? Maybe when you abandon her, that is the time. You don't know. So that is number two. Number three is environmental pollutants. All this dust, all this pollution around here. You got to be very careful of environment you find yourself. You don't just go to a place. Some of you drive, and when you are going, a lot of dust. Instead of you to wind your window up, you don't do that. Some of you sit where people are smoking. You inhale that smoke. That can affect your body system, because we have different body. The way our body reacts to things around us is different. If you see many people sitting down, receiving all this smoke, all this pollution, that doesn't mean you can do so. You know why? Because your body is different from theirs. Next is excessive weight gain, and that is overweight and obesity. Some of you have too much of weight, and you still complain that you can't get pregnant. Obesity is one of the factors that can be a barrier for you getting pregnant. You need to lose some weight. If you overweight, if your BMI is too high, don't even think of getting pregnant. Don't think of it. You need to lose weight. Thinking of getting pregnant is going to be difficult. It's impossible with overweight. Yes. And the last one is nutritional disorders and nutritional style, which will take us to our main discussion for today. Now, let's jump right into the main discussion of today. And that is the influence and implications of nutrition on fertility. And we are addressing the following, and I want you to pay attention. Number one is connection between fertility and diet. Is there any correlation between these two? Number two is the effect of nutrition on reproductive organs, your fertility, your ovulation, your sperm. They are your reproductive organs. Your vagina, your womb, your uterus. They are all your reproductive organs. The effect of nutrition on these organs. We're going to be talking about it. We're also going to talk about foods that affect sperm, ovulation, and best foods to fuel fertility. And the best food to boost your fertility. We want to talk about it. And number four, which is the last one, what are the foods we must avoid if we are trying to conceive? Yes, the food to avoid when you want to get pregnant. So let's start by taking it one after the other. Number one is connection between fertility and diet. Is there any connection, I mean? Yes, there is. Besides aging, a number of non-modifiable lifestyle-related factors such as smoking, elevated consumption of caffeine and alcohol, stress, agony sports, chronic exposure to environmental pollutants, and other nutritional habits exert a negative impact on women's fertility. Yes, that is what they study, the scientists, the doctors, the nutritionists confirmed. Obese women show decreased insulin sensitivity, determining persistent hyperinsulinemia, which may be involved in the pathogenesis of polycystic ovary syndrome. So as a result, the reduced insulin secretion induced by dietary adjustments is an attractive non-pharmacological treatment to prevent infertility. And a Mediterranean diet aimed at maintaining normal body mass may be effective in the preservation of ovarian health and physiology. Now, with this analysis that I just break down for you, you will agree with me that there is indeed an interdependent correlation between nutrition and fertility. Number two is foods that affect sperm and ovulation. Does the food you eat affect your sperm as a man? Does the food you eat affect your ovulation as a woman? The answer is yes, they do. What we eat affects our reproductive organs. It affects our fertility. You know why? Because nutrition plays a major role in enhancing the reproductive efficiency both in women and men, and contrary to the detrimental role of body weight. But guess what? Sperm health is the last thing on the mind of most men. How nutrition impacts sperm is even further away from our collective consciousness. We don't think about it. We don't think about the strength of our sperm, the strength of our ovulation, our menstrual period. We don't think about it. No, we can't do that. There are some questions we need to ask ourselves when there is a delay in getting pregnant, when there is a delay of impregnating a woman. There are some questions you need to ask yourself. Do you sit down and ask yourself why there is increase in infertility? Do you ask yourself at any point in time that why is the quality of sperm decreasing? Do you ask yourself, is this really a problem? If you have a low sperm count, do you even ask yourself that is this really a problem? Can we blame this problem on the food we eat? Do you sit down and ask all these questions? These are the questions we should be asking ourselves. We shouldn't be blaming others for our problems. We shouldn't be holding other people responsible for our problems or our mistakes. You know why? Because the problem may be coming from you. You may be the cause of that problem. And the answer is yes. It is a problem. And food can indeed have influence on it, on our infertility. Yes. Falling sperm count combined with the trend of having children at later ages means that some couples will face difficulties with fertility. Let me explain to you what this means. It means that if you have low sperm counts at old age, that means this couple who are trying to have a child will have a difficulties with fertility, meaning you won't be able to conceive. Yes. Either man or woman. If you've aged, if you are in your menopause, and your husband is having low sperm count, the sperm of your husband is low, and you are already out of the box, meaning that you are in your menopause. Except, remember I said it last week, except if the menopause is reversed, which I'm working on it now to find out if it's actually true. Definitely, you are facing infertility. You can't become pregnant. You can't have baby naturally, except you go through IVS. Yes. Now, why are sperm counts dropping? That's another question we must ask ourselves, especially men. Why are sperm counts dropping? Is our diet, the food we eat, killing sperm? What we eat, are they the one killing the sperm or affecting our ovulation, our menstrual cycle, our uterus, our body in general? The answer is yes. What we eat is always a culprit for any health problem. I said this multiple times, and I will continue saying it as long as I live. What goes into this mouth is always the problem. Yes. It determines our existence. It determines whether you are well or you are sick. It determines whether you are healthy or you are unhealthy. What you put into this mouth, what goes into this body. And that is why you have to be very careful and pay attention to what you do, what you eat, and what you apply on your body, on your skin. This is very important. And the good news is, there are also food that may increase sperm count. Here we go. The next, which is number 3, is the best food to fuel infertility in women and men. Your ovulation and your sperm. What are the food? The best food for this. What can you eat to boost this, your organ, your sperm and your ovulation? What can you eat? What type of food you can live on, you can experiment on to boost this fertility so that you don't face complication of having infertility? Yes. The study showed that female and male preconceptional nutritional status influences fertility and prenatal conditions. Study performed on over 160 women from the food, lifestyle, and fertility revealed that a diet rich in fish, listen to this, legumes, vegetables, and low in carbohydrate was nearly related with red blood cell folate and vitamin B6 in blood and follicular fluid, with a 40% increase in the chance of pregnancy by IVF. That is in vitro. Now, for women trying to become pregnant naturally, without assistive reproductive technology such as an in vitro fertilization, vitamins and nutrients like folic acid, vitamin B12, omega-3 fatty acid, and Mediterranean diets such as fruits, vegetables, lentils, beans, whole grain, millet such as brown rice, barley, and so on, fish like salmon. And let me tell you, salmon contains the nutrient called selenium, which promotes semen health. So, all this food were linked to positive effects on fertility. Vitamin D, antioxidants, caffeine, dairy products, soy and alcohol also appears to have little effect on fertility, according to the research. But trans fats, an unhealthy diet, those rich in red and processed meat, potatoes, sweets, and sweetened beverages, were found to have negative effects on our fertility. Yes. Another study also found that semen qualities improve with healthy diets, while the poor semen have been linked with diet high in sugar, diet high in saturated or trans fats. So any food with all these trans fat, sugar, saturated fat or trans fat, you want to avoid it if you want to get pregnant. All these sweetened beverages, the Milo, the drink, the soda, all this, you just want to get rid of it. There are a lot of women, they don't drink water. All they drink as their liquid is soda, Fanta, Coke, Sprite. That's what they drink every day. Some cannot even remember when they take water. No, you cannot do that. Water is essential. I've talked about water here. If you know what water does in your body system, you want to live your life on water. I'm telling you. And when you are in a situation like this, you want to avoid drinking all these sweetened beverages. Yes. And for couples receiving assisted reproductive technologies, IVF, women may be more likely to receive, to conceive with folic acid supplements or a diet high in isoflavones, that is a plant-based estrogen with antioxidant activities. While male fertility may be aided by antioxidants. That is why I said antioxidants have little effect because it's coming from male. Yes. So if you are trying to conceive, you want to consider the following. Number one, you want to avoid soda. Like I said earlier, you want to avoid soda or energy drinks and any sugary sweetened beverages such as Milo, cappuccino with sugar, any sugary food you want to avoid. You know why? Because consumption of sugar sweetened beverages was linked to lower fertility for men and women. That is the reason why you want to avoid drinking, taking, eating all the sugar sweetened beverages. You want to avoid them if you want to conceive. Not even if you want to conceive. If you want to live a healthy life, you want to avoid anything sugar, anything salty, any processed food. You want to avoid them because this is what kills our body anyway. Number two is you want to avoid fast food and eat more fruit. You know why? Because women who consumed high amounts of fast food and little food took longer to become pregnant than those with healthier diets. So you want to live on fruits and other healthy food and avoid fast food. Those of you that live in restaurants, fast food, Domino, Madano, all this and that, you want to avoid them. Especially when you are trying to conceive, at least for now, avoid them. Because these are the things we don't pay attention to. Next is you and your spouse want to eat more seafoods, such as salmon, scallops, and shrimp. At least 2 servings per week. You know why? Because couples eating more seafood were pregnant sooner than those really eating seafood. So you want to make sure that what you eat henceforth, if you want to become pregnant, you want to get pregnant, you want to make sure you live on seafood. Most those red meat or just forget it for now. Eat more salmon. Salmon is my favorite anyway. It's not because I want to get pregnant. I'm done with that. But if you really want to have baby and you want to have healthy baby, you want to eat more fish because you get fatty acid. The best fats your body needs is coming from the fish and other food that can give you fat. And lastly, you want to take a prenatal vitamin at least once a month before trying to conceive. Because many people don't take supplements and yet you don't eat the food, that can give you all these nutrients. And that is the meaning of supplements, all these vitamins and minerals. They are supplements. They supplement what you cannot get from the food you eat. Because all this food we eat cannot give us all the nutrients. That is why you have supplements like vitamins and minerals that you can take to supplement what you eat so that you get enough nutrients in your body. So if you are trying to conceive, you want to take prenatal vitamins at least once a month. You can take it every week, every day. And if you want to take vitamins, you need to see your doctor. I've said that multiple times on this show. Vitamins intakes is not something you can just decide and go to the store, go to the counter and buy it and start taking it. No, you need to do a blood test that will determine how low or high your vitamin is in your body before you can take another, vitamin or more vitamins. So it's not something you can just take. That is why you must not take it in excess. And that is the reason why I said at least once in a month, meaning that you must take it. You cannot avoid not to take supplement because you are not getting all these vitamins and minerals, nutrients your body needs from the food you eat. In fact, some women that are crying for baby cannot even remember when they take orange, when they eat fruit like apple, like kiwi, strawberry, all this cranberry. They can't even remember. Some can't even eat fruits once a month. And this is what you need. In fact, let me tell you the secret. If you want to have a beautiful baby, you want your baby to look beautiful and healthy, fruit is the best food for you during pregnancy. Yes. And you know this health of the baby, a healthy baby, their life starts from the womb, from the fetus. When the day you conceive, that is when the health of your baby begins. So you must eat healthy from the pregnancy. Yeah, from the pregnancy stage, you must start eating healthy. Maybe when you finish having your baby, you deliver your baby, you can go back to your healthy life. But for that baby, you must eat healthy. So before you get pregnant, you need to prepare your womb for that baby to live. Yes. Next, which is the last one, is the effect of nutrition on reproductive organs. And this addresses the impact of nutrition on fertility in both men and women. What are the impacts? Here is what the study says. The studies show that the role of different nutrients, such as protein, carbohydrate, lipids, antioxidant, folate, even the Mediterranean diet, have impact on female fertility. Yes. That is what the study shows, and I confirmed it. Here is the bottom line. After 6 months to a year of trying, if you know you've been trying over 3, 6, 1 year, and nothing is coming forth, you're not getting pregnant. Depending on a woman's age, I recommend a couple go for an infertility evaluation. At that point, it is more likely that there is a problem preventing pregnancy. Yes, and you'll be able to know what exactly the problem is. But if you're not going for any test, if you're not seeing your doctor, remember I said, if you are facing this crisis of infertility, the only doctor you can see, the specialist you must see, is fertility doctor. Or OBGYN, gynecologist. Yeah, fertility doctors. These are the doctors, the specialists you must see concerning your problem. Don't see any other doctor. Please, see the right doctor. Some couple don't see their doctors. They don't check themselves out. Even medically, they don't do that. Yet, they still complain of not getting pregnant. So you need to do your own part. You need to see your doctor as soon as you realize that this is not happening. I'm supposed to be pregnant by now, and I'm not getting pregnant. Between 1 to 3 to 6 months, if you are not getting pregnant, something is wrong. Either with you or something is wrong with your husband, your spouse, your partner. And this is the reason why you must see the doctor as soon as possible for better options of treatment. In recap, I just reviewed with you how several lifestyles and rough nutritional regimes may interact with the reproductive health in women and men, and how adequate nutritional support may improve fertility. I just told you everything you need to know. If you are a man or a woman trying to become a parent, you want to eat healthy diet. You want to try to maintain a healthy weight prior to your conception. And you know why you want to do that? Because obese women have a higher risk of complications. And you don't want this. Some still get pregnant with their weight. But during their labor, they experience complications. Go and ask them. And please, this one is very important as well. You want to take prenatal vitamin at least once a month before conceiving. And you also want to avoid excessive vitamins before conception. You don't want to take too much. You know why? Because too much vitamin A intake, for example, can be bad for a developing fetus. Yes. That is the reason why you want to be very careful in taking vitamins, especially vitamin A. You also want to consider seeing your doctor for a preconception visit to review what you can do to optimize your chances of successful pregnancy. For example, certain medications are harmful to the developing fetus and should be stopped well before planning a pregnancy. Let me stop here so that I can come back here next week for another educative topic. I'm Dr. Betty. Have a good night. Bye.